Welcome back to NBC Current Affairs. In flood-prone communities across Port Moresby, stagnant water left behind by heavy rain is becoming a breeding ground for mosquitoes carrying malaria and dengue fever. Health authorities warn that changing weather patterns and rising temperatures are increasing the risk of mosquito-borne diseases, placing more pressure on families and urban clinics already struggling with limited resources. Stella reports.
Heavy rainfall, flooding, and warmer temperatures are creating ideal breeding conditions for mosquitoes across the nation's capital. After heavy rainfall, drains, discarded containers, plastic waste, and old tires collect stagnant water, allowing mosquitoes to multiply within days. Swampy areas and overcrowded settlements with poor drainage are a perfect breeding ground for mosquitoes. Roslyn Ban, a mother and a grandmother, lives in Makana settlement, just meters away from a swamp. During heavy rainfall, she worries not only about the flood waters entering her house, but also the mosquitoes that follows.
Big rain, sometimes there's a patient plenty problem. We got big flood and come.
We face many problems whenever there is heavy rain. There is usually severe flooding and the water can rise higher than a person and almost reach our house. When the floods come, they destroy the plants, flowers, and the fence around our home. During the rainy season and flooding, there are also many mosquitoes. In the evenings and at night, we often make fires to chase the mosquitoes away.
With grandchildren under the age of 5, Roslyn makes sure every night that children sleep under mosquito nets for protection.
Night, maybe like sleep inside a mosquito net.
At night, we either sleep under mosquito nets or burn mosquito coils. However, there are many children in the house and the smoke from the mosquito coils sometimes makes them cough and become sick. Sometimes when we sleep without protection, we get malaria. We often go to the hospital for treatment. We travel back and forth to the clinics because we live beside a swamp where there are many mosquitoes that spread into our house and the neighboring homes.
Last year, Roslyn was diagnosed with malaria and typhoid. After going through a life-threatening experience, she does not want her children and grandchildren to face the same situation.
Our house has incomplete windows, so we are always afraid of mosquitoes entering at night. I make sure my family sleeps protected from mosquito bites, and I also try to sleep under a mosquito net. Last night, however, I could not use mine because I had just returned from a camping trip and my mosquito net was dirty. Because of that, I did not sleep well.
The World Health Organization reports that Papua New Guinea accounts for the majority of malaria cases in the Western Pacific region, with more than 87% of the cases and 91% of the mortality. The National Department of Health reports around 1 million malaria cases in Papua New Guinea every year. Health experts say changing weather patterns, prolonged rainy seasons, and rising temperatures are contributing to the spread of mosquito-borne diseases. Warmer conditions are also allowing mosquitoes to survive in areas previously non-affected by malaria, including parts of the islands region. But in Port Moresby, health workers say the risk remains constant during extended periods of rain.
For us in here, entity itself is basically, like as I've said, the cases are not so much like, increasing or decreasing. It's more or less like in the same kind of rate. But especially when we had with changes in weather, especially in wet seasons, that's when you see an increased number of cases coming in. Like we had a similar issues last year, towards the end of last year. And we did some investigations, especially those ones coming in with fever and chills. headache, and we have did some investigations, and we have found out that many of these patients are actually coming from around this central province.
At Gordon's Urban Clinic, located near one of the Port Moresby's busiest commercial areas and bus stations, health workers attend to patients with malaria symptoms almost every day. Officer in charge, Sister Nelly Legeme, says while NCD has recorded fever malaria cases compared to some provinces this year, many patients treated at the clinic travel in from nearby Gulf and Central provinces.
We keep all our patients here. From here, we bring our patients in for screening. We have screening rooms inside. After screening, when we find out during the assessment, during the examination, when we do upon our examination or upon our history taking, when we find out that they have the symptoms of malaria, we send our patients for malaria diagnosis test. And upon the reporting or upon the assessment, we find out that all the patients are from Gulf province and Central province are the positive ones. Only few are from NCD, month of April. We have captured 351. We have done 351 patients screened for malaria, and out of the 351, there are 45 patients who were positive of malaria. Upon the results, we put them on anti-malarials.
Within NCD, most of the patients that visit clinics are from settlements due to overcrowding and unhealthy environment, which are highly favorable for mosquito breeding. Despite the health threat, access to insecticide-treated bed nets or mosquito nets remains a major challenge. Sister Legeme says shortages in mosquito net supplies continues to affect clinics, forcing health workers to prioritize pregnant mothers and young children.
According to the Rotary Against Malaria, they advised us that there's not enough, they ran out of the supply. So they are only giving it to the antenatal mothers only, but not the positive patients where we used to give before.
At Morata Urban Clinic, health workers shared similar concerns about limited prevention resources and increasing public health risk during rainy season.
The Rotary only brings our nets for the ANC mothers. First they bring for malaria patients, but then I think they stopped or they haven't been bringing them now.
Same logo than store.
Yeah, they haven't bringing them down, so we were using the ANC ones.
Okay.
And then the ANC said, no, that's for ANC and ANC only, because we miss short team the ANC, we are giving it to the malaria positive patients. So when they come, we don't give them mosquito net. Now first we used to give them mosquito net every time they come for me, like when they are positive.
For families living in flood-prone communities across Port Moresby, the fight against malaria and dengue is becoming an increasing concern, one that needs urgent actions.
Finally tonight, as health authorities continue responding to the growing risks brought on by flooding, poor drainage, and changing weather patterns, awareness and prevention campaigns are becoming increasingly important in the fight against mosquito-borne diseases. In the National Capital District, schools and communities are now being targeted through nationwide malaria awareness programs aimed at educating families, encouraging early treatment, and promoting prevention measures. The campaign forms part of wider efforts by the National Department of Health and its partners to eliminate malaria in Papua New Guinea by 2030. Stella Martin reports.
Yes, now we must. End malaria. To protect lives now.
Community awareness campaigns are now becoming a key strategy in the effort to eliminate malaria transmission across Papua New Guinea. At St. Peter's Primary School in Port Moresby, students gathered to mark World Malaria Day under the theme Driven to End Malaria, Now We Can, Now We Must.
Mosquito bite our skin and we get our malaria. Okay! Amen!
The program focused on educating students about malaria prevention, recognizing symptoms, and the importance of seeking treatment early.
Malaria is a treatable disease. We have the medicines which can treat, which can kill that parasite that I mentioned and make you a better person, can be cured. So that can only happen when our sick people who are sick with malaria come to the health facilities, get tested, and start on the treatment. Okay? They don't come to the clinic, if they don't get tested, they run around there's a high chance that they will die.
Acting Manager Public Health at the National Department of Health, Dr. Jacob Kisom, says eliminating malaria will require collective responsibility from everyone in the community, including school children.
We need every human being that is available to play their part to control malaria. So students, you too, you have a responsibility, you have a role to play. In this country, every year, through our clinics and hospitals, we are getting about 1 million cases. That's for those that are coming to the health facilities and getting counted and reported in the system. There are many out there who are not reported and who are not counted.
According to the National Department of Health, children under the age of 15 account for approximately 20% of the 1 million malaria cases reported annually in Papua New Guinea. Health experts say women and children remain among the most vulnerable groups affected by malaria infections. Deputy Public Health Director for the National Capital District Provincial Health Authority, Dr. Rose Moore Candelio, says early diagnosis and treatment remain critical in preventing severe illness and deaths caused by malaria. Symptoms commonly include fever, headaches, vomiting, nausea, fatigue, and joint pain.
When you see malaria for pregnant mothers, babies start rubella. Malaria.
When mothers are diagnosed with malaria, the parasite attacks the red blood cells, as Dr. Kisombe explained. When malaria parasites affect the red blood cells, people can develop anemia because the blood can no longer carry enough oxygen and nutrients to the body, brain, and heart. This causes fatigue, weakness, and nausea. For pregnant mothers, malaria is especially dangerous because babies may not receive enough oxygen and nutrients. As a result, babies can die from birth or may be born weak and malnourished.
As part of the campaign, students also shared their experiences of how malaria has affected their health and education.
I once vomited many times and my mother took me to the ghetto hospital. At the hospital, the doctor diagnosed me with malaria. The doctor told me that I could have lost my life if I had not come for treatment earlier.
I am currently in grade 5. Last Thursday, I stayed home because I was not feeling well. I think I had been bitten by mosquitoes. I told my mother to take me to the clinic and she did. At the clinic, my blood was tested for malaria and I received treatment. Because I was sick, I missed 3 days of school.
Health officials says educating children is important because they can help spread awareness within their homes and communities. The campaign forms part of a wider national strategy led by the National Department of Health in partnership with Rotarians Against Malaria and World Health Organization. The strategy includes free mosquito net distribution, universal malaria testing, vector control programs, and targeted community outreach activities across the country.
We have treatments always available for malaria in terms of antibiotics or even screening them. What we provide to the clinics are basically those rapid test kits. Those rapid test kits can be used at any facilities to basically, rather than taking the samples to bigger laboratories, we have those rapid test kits where anybody of the signs and symptoms of malaria can quickly do a prick and then start testing themselves to exclude whether they have malaria or not. But in terms of many of these test kits are actually provided by the RAMP and the department for us to basically use at the facilities. And when we say that people are actually been tested positive for malaria, then we have those drugs available like Mala-1, Mala-2, Artimata, and all that stuff. And depending on especially in areas where malaria is so endemic, we have those treated bed nets available. We have those sprays and bed nets available. So with the assistance of RAM, we do go out and distribute all those treated bed nets.
Public Health Director for the National Capital District Provincial Health Authority, Dr. Amos Lano, says maintaining healthy and clean environments will be critical in achieving the country's malaria elimination target by 2030.
With the department, also with the REM, we are basically advising people to, especially in terms of cleaning your areas and your community safe. Okay, in terms of clearing empty containers or pools where mosquitoes are likely to breed, and also areas where you have trees that accommodate mosquitoes. It's good to clear your area so that there is enough light. Mosquitoes most likely to sort of breed in areas where there is darkness and there is wet and pockets of water, pools available. So it's good that this kind of things has to be cleared, ensure that there is enough sunlight, the waters are cleared, the containers have been removed and put away, especially keeping the area cleaner.
With just 4 years remaining before the national target deadline, health authorities says stronger partnerships between communities, schools and health agencies will be essential in ending malaria in Papua New Guinea.
And that's the show for tonight. Until the same time tomorrow night, I'm Jerry Tabe. Have a pleasant evening. Good night.